Okay, thank you for everybody for attending today. On behalf of Flagler Cares and One Voice for Volusia, welcome to the 2021 Health Human Services Summit. My name is Jim Clark and I will be the moderator for this session. You have joined the session titled Innocuous Partnerships to Address Social Determinants of Health. All participants will be muted. There'll be a Q&A at the end if we have time. You can also use the chat box down at the bottom and to ask questions, and Christina will answer your questions for you. So thank you to the sponsors who made this event possible: Advent Health, Career Source, Flagler Volusia, SMA Healthcare, Magellan Complete, Department of Children and Families, and the House Next Door. It is my pleasure to introduce you to your trainer for the session, Christina Walters.
Hello, thank you. Happy to be here today. I'm going to be presenting about unlikely partnerships to address social determinants of health. As Jim said, my name is Christina Walters, and I'm the manager of public interest and medical legal partnerships at Community Legal Services of Mid-Florida. Today, I want to teach you about what a medical legal partnership is, why these partnerships exist, the types of health harming legal needs that low-income clients like you serve have, and how medical legal partnerships address those social determinants of health. So a little bit of background about my organization. I work with Community Legal Services of Mid-Florida, and we are the primary source of no-cost civil legal aid for no-income, low-income, and moderate-income residents here in Central Florida. Our advocates provide legal advice and representation to more than 20,000 people each year. And what we do is essentially, we are the civil arm of what the public defenders do. We're not a government employee. However, just like in criminal law, you have the right to an attorney. In civil law, you don't have that right, except for very, very few instances. And so for everything else, for people who are trying to get an injunction against domestic violence or get a divorce, people who are trying to fight an eviction, or bring a claim against discrimination in the workplace, they don't have a right to an attorney. And so that's where we come in for those who can't afford them. And the great thing about our services is we're free for clients. So we cover 12 counties here in Central Florida, Community Legal Services, including Volusia and Flagler County. And we have 2 offices that serve your area, one in Daytona and one in Deltona. There's other organizations like ours that cover the other counties throughout Florida as well. So if you do happen to have clients who come in from other parts of the state, there are other organizations like ours out there. And we provide assistance in a really big variety of cases. So everything from family law to housing, public benefits, children's accommodations and schooling, debt collection and garnishment, you name it, pretty much we do it. The only areas of civil law we really don't get involved in are related to like personal injury, medical malpractice, those types of cases. And that's because those attorneys generally work on a contingency fee basis. So there's no out-of-pocket expense for clients already. But as you can see, we help in a lot of different areas. We also have non-attorney staff that do things like budget and credit counseling, home buyers education workshops through our housing counseling unit. We also have a helpline. Our helpline is staffed by attorneys here at CLSMF. We have access to that, and I'll give you the phone number for it and all at the end. We have access to that via telephone or online through a chat. And then we also have our application available online as well, trying to open up the doors for folks, whatever's going to be the easiest way for them to get to us. When you call or get through the chat on through our helpline, you go through an eligibility intake, and so long as you're eligible, you'd be able to receive advice right then and there on the phone or via chat. All right, so you're probably asking yourself, why is there a lawyer here at the Health and Human Services Summit? And that's because of something called the social determinants of health. Social determinants make up, different estimates depending on what studies you're looking at, somewhere around 70% of a person's health. So take out genetics, take out access, or take out medications, that kind of thing. We have the neighborhood you grow up in, your access to healthcare, your access to a good quality education, economic stability, having the resources that you need to get by. Those things make up more than your health than just your genetics and biology do. And then on top of that, we found through the Legal Services Corporation does a justice gap report every few years. And in 2017, their justice gap report found that 71% of households, low-income households, had at least one civil legal problem in the year prior. A lot of these legal issues and needs go unmet. There just aren't enough services like mine out there. There aren't enough attorneys. There aren't enough resources. Folks don't even know that they really have a legal issue in some instances. And so those needs go unmet, and they can actually create barriers to health. They can create barriers to healthy eating, suitable housing, stable employment, self-sufficiency, and safety. So a medical legal partnership is actually an upstream approach to address these issues. We embed an attorney right there into generally a healthcare team, but this can work just as well within another community organization. And the providers screen for social determinants, usually in healthcare settings anyways. And so we train them to recognize when there's really a legal issue at the crux of that problem and make those referrals over to us. So I mentioned we do this by training staff. We treat the patients one-on-one with their specific legal needs. We help transform clinic practices by doing things like implementing letter templates that allows the providers to help advocate on behalf of their patients without an attorney ever needing to get involved. By training that one provider on how to do that, we can impact all the patients they ever see versus just the tens or hundreds that I'll be able to see over the next couple of years. And then we also prevent social determinants even further upstream by doing things like taking impact cases, helping to shape and form regulations that impact population health. A good example of this is out of Medical Legal Partnership in Jacksonville. Jacksonville area legal aid recognized when the whole Zika virus epidemic was going around that there was nothing on the books that required landlords to have screens on doors and windows in the area. And because it's such an older town, a lot of the places didn't have air conditioning. So you have Florida in the summer with no AC and people wanting to open their windows, but mosquitoes and Zika being a serious threat. And so they got involved and they got the county to change the ordinance so that now landlords are required to have screens on their windows, helping prevent the spread of Zika there. All right, so how do we address the social determinants of health? In medical legal partnerships, we use this acronym IHELP. So the I stands for income and insurance. Things like increasing access to resources to meet your daily needs. So think appealing denials of public benefits. Think about things like accessing Medicaid, appealing denials within your insurance. So maybe you have insurance coverage, but they're not covering a particular service that you need, or a service or a particular piece of medical equipment that you need to be able to improve your health. The H stands for housing and utilities. Here we help to secure stable housing and quality housing. So folks who don't have working plumbing in their households, folks who might have a utility shut off coming up, but need a refrigerator to store their medications, or need the electricity to be able to keep their oxygen running. We also can do things like preventing eviction, preventing foreclosures. And that's real big now with all of the COVID stuff. We're doing a lot of work in the area of eviction prevention, helping to set folks up with other resources where they can receive some funding to be able to assist them staying in their homes, and also helping to educate the community on what their rights are with COVID and the CDC moratorium. The E stands for education and employment. And under here, we were able to do things like securing specialized education services for students with disabilities under 504 plans and IEPs. Also, disability accommodations in work, enforcing other workplace rights, and we also do other work like our children's rights unit does here already at CLSMF, doing things related to suspensions and expulsions, in-school arrest, that kind of thing. The L stands for legal status. And so legal status covers actually a pretty big range of things. Legal status can include resolving veterans' discharge status issues. Getting a discharge upgrade often opens the door for veterans to receive more resources from the VA, different levels of healthcare, access to other resources, access to a pension and disability benefits. Those types of things can be impacted by their discharge status. And so by getting them an upgrade, we open the doors to that. It can also include things like clearing a person's criminal history through expungement, or even immigration. An adjustment in an immigration status can open the doors, again, kind of like with the veteran discharge status. It can open the doors for different levels of public benefits, disability benefits, insurance benefits, and that kind of thing. And then finally, the P stands for personal and familial stability. Here we do things like securing restraining orders for domestic violence victims, enforcing parental rights, all of the family law issues you can think of: custody, visitation, child support, alimony, divorce, all of those types of things fall into there, as well as advanced directives. So creating healthcare surrogates or power of attorney, so that folks who might need some additional assistance because of their healthcare needs can have somebody else assigned some authority to do those things. So medical legal partnerships are not something new. Really, they've been around since the 60s. So we first have a medical legal partnership documented in 1967, where Dr. Jack Greiger hired a lawyer to address his patients' food and housing problems down in Delta Health Center in Mound Bayou, Mississippi. This is also the first federally qualified health center in the US. So no wonder they were bringing in other enabling resources then, right? Other enabling services. Then we had in the 80s, health institutions partner and work closely with civil legal aid agencies to meet the end-of-life needs of AIDS patients. They were doing things there like drafting powers of attorney, healthcare surrogates, living wills, last wills and testaments, helping folks take care of those end-of-life needs so that they can have a little bit less stress while they're going through that. In 1993, medical legal partnerships as we practice them today were created at the Boston Medical Center. There, a doctor in the pediatric unit, the emergency department, realized that he had patients who were coming back very frequently with exacerbated symptoms of asthma. And when he found out more about the family's background, he found that they were going home to places that had mold, or didn't have heat in the winter, or had infestations of rodents or bugs. And those are all things that landlords are legally required to take care of. And so he got an attorney from the Greater Boston Legal Services involved to get those landlords to do what they were legally responsible for doing, and then found that his patients weren't returning with those same symptoms as frequently. And that's how our partnerships kind of evolved from there. In 2006, the National Center for Medical Legal Partnerships formed. And they lead now education, research, and technical assistance to medical legal partnerships throughout the country. They are a huge wealth of knowledge. They have hundreds of resources on their website. If you're interested in this topic at all, I very much encourage you to go ahead over there and check out what they've got. They have issue briefs on a variety of patient populations, on a variety of healthcare settings. They actually have one that's about the statewide collaboration that we've done here in the state of Florida is up on there. They have a toolkit that they recently came out with that helps walk health centers through how to form these medical legal partnerships that would work just as well for any community organization, even if you aren't necessarily medically based. And they also have a listserv where they send out, I think it's monthly, emails of resources, new briefs that they've come out with, as well as links to sign up for different webinars through both them and other agencies that talk about medical legal partnerships. And so presently we have health centers in over 400 organizations within the United States, including 48, or I'm sorry, within I don't know what happened there. Sorry, I rolled my mouse there a second. We have 400 health institutions with medical legal partnerships in 48 states, including in Florida. And so in Florida, we have 18 medical legal partnerships throughout the state. So some of these cover just one health institution. It's one healthcare institution, one legal aid institution. Some of them are one legal aid with multiple healthcare partners, and some of them are one healthcare partner with multiple legal aid partners. They include children's hospitals, VA hospitals, dental clinics, federally qualified healthcare centers. We have one here with the West Volusia Hospital Authority. They cover, I want to say it's 32 counties of the 67 in Florida. And the patient populations are everything from children to seniors to folks with a particular healthcare need, to veterans only, to homeless only, and kind of everything in between. So next I'm going to show you guys a brief video that gives you kind of a better look into what medical legal partnerships do. And this is a real life example out of Jacksonville Area Legal Aid's Medical Legal Partnership. We tested this a minute ago. Let me try again. It's always something with technology. Sorry, guys, bear with me. There we go.
Christian was diagnosed with bone cancer, stage 4, in his pelvic bone back in October. And by November, we started treatment. Roughly around December-ish, he became wheelchair bound. Getting him in and out, obviously with wheelchair or walker, our only option was the garage. We were having problems with the garage door, told the rental company. They wouldn't return my phone calls, they weren't answering my emails. They weren't giving us any kind of ETA on when it was going to be fixed. And that meant he was stuck in the house.
I wanted to go outside a lot, I wanted to, do normal teen things, just go, maybe go outside or go to the mall or something.
Once legal aid stepped in, they sent a notice to the rental company, and within the next day, legal notice, they had somebody out here to fix the garage door. I approached them about putting in a ramp and a sidewalk really into the front door, and the rental company kind of went back and forth with me on whether or not they would allow it or not. Legal aid stepped in and helped us. Again, they composed a letter to him asking him if we could put in a sidewalk. Without legal aid, I don't think the sidewalk would be a possibility at all.
We're thankful to legal aid for all the help they've given us so that we can get our son out of the house.
It allows him to be more independent. So, which I know he's missed over the last few months. He's 14 and everything's been taken from him.
Thanks to legal aid, now I can get out and I love to hang out with my friends, and for a 14-year-old, that means a lot.
Okay, so that's just a real life example of what medical legal partnerships can do. I mentioned earlier that we have a statewide medical legal partnership network, and through that, I lead medical legal partnerships throughout the state. We do, now they've kind of moved to quarterly calls and trainings. We generally have a yearly summit. Last year it went virtual, and this year we're kind of holding out, hoping that we can do something in person towards the end of the year once folks have more of a chance to get vaccinated. We provide technical assistance to those who are starting up or looking to make changes within their partnerships, and otherwise provide assistance as needed. There you can find that website there, for fladvocate.org/medical-legal. You can find a bunch of resources there from Florida Medical Legal Partnerships, including an MOU, screening tools, things of that nature, and as well as a listserv to sign up for to find out more about our quarterly calls and trainings. So I have my last slide here. Generally, I take questions in between, so I'll stop here to go ahead and take questions. I see something flashing in the chat. Oh, thank you, Nancy. She says that the video is very impactful. There's on the National Center's website, they have some other videos. They also have a series they call Patients to Policy. And there they give a lot of impactful stories of that kind of nature, showing what medical legal partnerships do, some things, some big changes that we've made. There's also another video that I share frequently from the PBS NewsHour that is from, now I can't think of what city it's from, but it talks about a partnership that's for patients with cancer and how they were able to actually advocate for the insurance to cover some additional testing to make sure that a patient was getting all of the services that they need and that the treatment the doctor was suggesting was actually going to take care of the problems. And you see like the huge impact that things like that can make. A question came up: how do individuals access your services? So Community Legal Services of Mid-Florida, you can access our services by the information here that's on the screen. So we have a helpline, like I mentioned, that's staffed by our attorneys that can be accessed through that 1-800 number. So that's 1-800-405-1417. And that is direct to attorneys on the helpline. You can also go to our website, CLSMF.org, where we have a chat feature or the ability to pre-fill out an application and have a helpline attorney call you back. Any of those ways you would be able to you've reached the same set of attorneys at our helpline. They do an eligibility intake to make sure that you're eligible for services through one of the grants that we have. And then they provide advice right there over the phone, or they can make a referral in-house to one of our units for further representation. My unit, we partner with particular entities, and so we generally receive our referrals directly that way. In Volusia County, we actually receive funding from the West Volusia Hospital Authority to serve WVHA card holders in being able to get them onto a more secure, permanent form of health insurance. And so we do that through Social Security cases mostly, and sometimes also Medicaid. And so we represent folks who have the WVHA card in those cases and making those appeals to get them onto Medicaid or Social Security benefits so that they get the Medicaid or Medicare. We also now receive funding from WVHA to be able to represent those card holders also if they have emergency department bills from Advent Health or Halifax Health for services that weren't covered through any of their patient financial aid services that they have at the hospital. Patients or WVHA card holders for either of those issues can be directly referred to myself or through or to our new advocate. Her name is Lisa Guerin. So my email address is Christina R, so CHRISTINAR @CLSMF.org. And then Lisa is lisag@clsmf.org. Again, for direct referrals to us, we ask that they be WVHA cardholders for one of those two issues. Everything else we ask to go through the helpline. We've also recently started rolling out an online referral directly for the WVHA cardholder. So if you're an organization that assists a large percentage of cardholders and you'd be interested in learning more about how to do those online referrals to us, I'm happy to speak with you and work with you to get your staff trained on how to do that and what kinds of referrals we're looking for and that kind of thing. If you're looking for a training for your organization, for your staff on any of the areas of law that we practice in, and I'm actually going to scroll back to show you what those were again. We can have staff appear virtually or in person to train your staff on any of these areas. We also do community outreach and clinics for your clients. So we can either train your staff on various legal issues, how to spot these issues and when to make referrals, when to tell folks to call us, legal information that they can provide, resources they can pass on. We also do those types of presentations for clients, teaching them what their rights are, how to advocate for themselves. We also are pushing right now some pro bono opportunities and outreach that way, where we're using pro bono attorneys who are volunteering their time to represent folks. We know, like I mentioned earlier when I was talking about evictions, we know that there's going to be a lot of those coming up. The CDC moratorium, in case you don't know, the CDC had released an order stating that folks could not be evicted due to non-payment of rent during the course of COVID pandemic. There's been a federal court that has come out and kind of shot that down, but they have put a pause on doing away with it until the appeal can go through. So we know it's coming to an end soon, and we're trying to prepare folks for that. So if you have a event coming up that we can help get the word out at you have a group of clients that you'd like for us to come speak to, or again, your staff, please let me know and I'm happy to make those arrangements. I'm going to go ahead and put my email address in the chat box for you all. Okay. Are your housing resources funded by HUD? If so, can current recipients of other HUD programs also benefit from your resources? So our housing counseling and the budget and credit counseling, they are funded through HUD. Can recipients of other HUD programs also benefit? I don't see why not. I do know they would be eligible for other services through our organization. So if they're receiving HUD services through you guys, I don't see why they wouldn't be able to get family law help or veterans help or anything like that through us. If you want to send me an email and ask specifically like what your services are, I can follow up with our the head of our housing counseling unit, because she works directly with that grant. She'd probably be able to answer that better than I can. No problem. Does anybody else have any questions? I know I finished very early. Well, I'm happy to hang out if anybody does have questions. Otherwise, I'm sure nobody's going to complain about some extra time within their schedule. Again, I'm here to answer any questions. I'm always happy to help put you together with your local organization if you're not necessarily within our service area, or you have your service area extends beyond ours. I'm happy to connect you to legal aid there. If you're interested in starting a medical legal partnership with your organization, I'm happy to start those conversations with you and talk about what that might look like at your particular organization. Each of them that we have looks a little bit differently, and it's based on the patient population you serve, how many days on site, what kinds of screenings you're already doing. All of those things come into play. So happy to help where I can.
Okay, if anybody doesn't have anything else, thank you for attending today. I'm going to go ahead and end this meeting. And if you want, you can navigate back to the event platform, Uva, or your virtual event program. And there is a lunchtime keynote session from 12 to 1. Thank you.